Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine. In just around 15 minutes, we'll bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by Dr. Aruna Nathan. Dr. Nathan is a board-certified physician specializing in internal medicine and lifestyle medicine with over 25 years of experience. She earned her medical degree from Seth GS Medical College in Mumbai, India, and completed her residency in internal medicine at MedStar Union Memorial Hospital in Baltimore, Maryland, where she also served as chief resident. In 2017, Dr. Nathan became one of the first physicians in the United States to be board certified in lifestyle medicine. Throughout her career, Dr. Nathan has practiced in Maryland, providing care in various settings, including private practice, hospitals, nursing homes, assisted living, and rehabilitation facilities. She has been recognized multiple times as a top doctor by Washingtonian Magazine. Currently, Dr. Nathan serves as the lead physician for lifestyle medicine at AbsoluteCare, where she focuses on integrating lifestyle medicine into primary care to address chronic diseases. Welcome, Aruna. How are you doing today?
I'm doing well, Padmaja. Thank you so much for having me here.
What a pleasure. So let me start our conversation by asking you if you could share your journey into lifestyle medicine.
Sure. I do believe that a lot of this was, my childhood really shaped all of this, right? So the seeds were possibly planted at childhood. I grew up at home. We lived with our grandma when we were young. So food as medicine was not an afterthought. It was really, in every essence. So we had food for every season. We had, we ate seasonally. We rotated foods. We had certain foods once a week. And so there was variety, but there was simplicity. And it was just part and parcel of who, I was. And then sports was a big part of my childhood as well. So staying active was important. And so as I me and my husband started a young family of our own. And that's exactly when we also, I was also a young physician beginning to practice. I couldn't separate the two. So I was trying to see how I could bring some of these concepts that we have at home to my practice. And that was my, early start. And then I was very interested in integrative medicine, but then I thought I should understand where that starts from. So I thought maybe I should learn more about Ayurveda. And as I was learning more, I realized that 90% of Ayurveda from my lens was lifestyle. And so and this was around 2015 or so. And then 2016, I happened to come across the American College of Lifestyle Medicine, and I was intrigued, and I went for my very first conference, and there has been no turning back since. I came back, motivated, and now I can actually take this to my practice officially, in a evidence-based manner, and my introduction, or that's how I got into the field of lifestyle medicine formally.
Wonderful. Wow. What an honor. You're one of the first ones to be certified as a lifestyle medicine physician. So great to have you. I actually did a year or two later. But how do you ensure that each lifestyle medicine plan feels meaningful and personalized to your patients? And what strategies do you use to help patients simplify their health goals and make consistent, attainable progress?
Wow, Padmaja, that is such an important question, right? Because the last thing we want to do as providers or as physicians is become so, we too prescriptive or
Yes.
because everybody is different. Everyone is ready to make the change at, different points in their lives. And our job as lifestyle medicine physicians or providers is to be present, to partner with them. And I think I draw a lot from my lived experiences, from my family history. You know, my brother had his first cardiac event at the age of 39, and
Oh
my
my gosh.
father was, he also at the age of 63 died from the first heart attack. So, I draw a lot from my personal experiences. And I also know how difficult it is to resist some of these choices, of different
Mm.
foods, because these are comfort foods for us. And so I always think about that and I practice with that in mind. Um, Really getting to understand the person, like, the patient or the person in front of you, getting to
Hmm.
understand their why, helping them
Sure.
figure out what matters to them the most, and then using that to motivate them, or they motivate themselves using that, right? And so that's the beauty of lifestyle medicine, that we can actually personalize this and
Sure.
using all the different tools that we have.
Hmm. Yeah, well said. When it comes to collaboration, what do you think, what should the clinical approach should be? And especially when you consult your patients, what do you think about the role of collaboration in your interactions?
It's the key, right? Lifestyle medicine is a team sport, and we know that only 20% of the health outcomes are, based on their medical services, and so much of it is outside of what we do. And most of the chronic conditions that we are dealing with, they are so multifactorial. We really need to approach it as a team. So
Hmm.
having a so when I was in private practice, it was more of referring them to the
Sure.
right resources. So we may have a community-based program, for example, like DPP, or we will, refer them to health coaches or lifestyle
Hmm.
coaches, dietitians, behavioral health therapists. And but now where I practice right now, I have the added advantage of, having many of these resources on site, and
Hmm.
we are able to actually even see our members, we call them members, together. So when I see a new person or a new member or a patient, many a times I see them along with my care plan manager, and we
Mm.
actually see them together, and we get to know them as a person.
Better.
And
Yes.
we refer most of our patients for behavioral health, which is also available on site. And so I think collaboration is key. Working with specialists is key, and that's the only way to tackle our chronic conditions today.
Absolutely. I know you are a big champion of shared medical appointments, and I wanted to ask you, why do you think it's the powerful lifestyle medicine care model that people should learn more about it?
Oh, yeah. I think that you can talk to anybody who's done a shared medical appointment or been part of it, and they will sing the praises, right?
Yeah.
Nothing that can compare to that. You are with your patients in a group setting. They are with each other. You can
Hmm.
have other members of your team as part of the group setting. So, and you're kind of just there to listen. And that's the beauty of a lifestyle medicine group visit, which is a little different because we go in there with knowing, we are basing all of this on the six pillars,
Sure.
but at the same time, we let the group guide us. And
Hmm.
what I've seen is, you really get to know know the people much better, and they get to know you. We let our guards down, so it's no longer this traditional consultation in a room between a patient and a physician. It's more like a classroom, but now it's also more like just a group, and they get to even make a lot of connections within the groups. It's a great social setting. Today when we are so concerned about the loneliness epidemic, groups
Yes.
really fill in those gaps as well. So many of them connect even outside the group, and they learn so much from each other, and we learn so much from each other in those groups. So I think um, having a group model of care delivery should really be part and parcel of every practice or health system, because it really lends the best way to practice when we're tackling chronic medical conditions.
Yeah, I couldn't agree more. I think it should be sort of a standard of care, perhaps in primary care. Really, if you want to transform primary care, this is really the care model should be integrated across the board. So, couldn't agree more. So, I know, Aruna, everyone's talking about whole person health lately, and you may have heard that. What does that mean to you, and how does it relate to your practice framework?
Sure. I love your questions, Padmaja. So, when you think of lifestyle medicine, um, you are approaching it as not just the person, but it's also, the whole community. You're looking at it from a very wide lens.
Mm-hmm.
Um, when we think of whole person care, we really don't want to isolate a medical problem. Most of our training is based on, isolating a medical condition and treating the medical condition like diabetes or blood pressure or heart disease or kidney disease. But with whole person, we are really thinking of not just that one person, but also where they live and what they have access to, what are the things they like to do, what are the things they do with their friends or relatives. So it's a lot more. And
Mm-hmm.
lifestyle medicine possibly, I think, is the only the only organization that truly has the framework to deliver whole person care in a very meaningful way. And when I say that, I mean, we do it, like we mentioned, in group medical visits, uh,
Sure.
collaboration. We're tackling things like the foods, sleep habits, how we deal with stresses or de-stressing, um, avoiding risky substances. And this plays into most of the chronic medical conditions we treat. And so that's how I think of whole health, is just delivering good lifestyle medicine and also partnering. For example, we will be soon launching um, a program for gut health, which will draw from some of the Ayurvedic concepts
Mm-hmm.
and herbs and the foods, and how that relates to gut brain health. And so there's so much scope to collaborate with others when we practice in this manner.
Yeah, I like what you said that lifestyle medicine offers the clinical framework to deliver whole person health in the real world right now. And yes, addressing the social determinants of health or health related social needs, and making sure that you're also taking care of their behavioral health, in addition to the six pillars that we all regularly address, and to really to deliver whole person health. So thank you for that. I know you have this big role right now as a lead physician for lifestyle medicine at Absolute Care. And congratulations for that new sort of. I don't know, when did you start, by the way? Was it this year?
I've been doing this for over a year now,
Over a
but
year.
I'm
Okay.
looking into that role a little bit more, and that's just happened. Yeah.
Yes. Yes. So we're very proud of you. But what do you hope to achieve in the next couple of years or 3 years?
So I do believe that, it's so Absolute Care is an amazing organization, and everyone who works there is just so dedicated, wanting the best for our patients. What I'm trying to, for example, one of the things we started is group medical visits. And so
Mhm.
initially it started just at the center where I'm at. And then there was another provider in Baltimore who also got certified for lifestyle medicine, and she's offering group visits as well. And we're going to expand this to some of our other centers in the country. So that's one aspect. But the the most important thing that I would like to accomplish is to really connect some of the gaps that we have. For example, in our community where we practice, we do have centers where, we have food banks and we have produce that we can use for our members, and those are good resources. But what's lacking is the connection. Many of our members don't have transportation to get to these locations. So how do we kind of come up with solutions to use these resources while we deliver these programs? So that's going to be one of my focuses. Really partnering with behavioral health is going to be another major focus, and really trying to not make this an afterthought like lifestyle medicine, but making it the foundation of care delivery, because that's what all of the major organizations, recommend. American Heart Association, ACC, American Diabetes Association, lifestyle interventions or counseling is the foundation. And I think that building that into the framework while delivering good medical care is what I envision.
Yes. And in addition, we know clinical practice guidelines for many chronic conditions also recommend lifestyle intervention as a first line of treatment. So yes, it makes perfect sense to make that as a foundation. Wow, your journey as a physician, your powerful message, and your wisdom are inspiring. I really enjoyed our conversation, but unfortunately, we are out of time. Thank you, Aruna, for sharing your time and expertise today. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.